Welcome back, everyone. We're going to be looking at different anatomical reference terms now. So when we talk about the head, whether we're talking about the cranium or the skull or the face or facial, the term for both of those is called cephalic. That's an important term. When we're saying skull and just the skull, we say it's cranial. When we talk about the face and only the face, it's facial. If we're talking about both the skull and the face, then we say this is the entire cephalic region, the cephalic region. When we talk about the forehead and only the forehead, we say it's the frontal bone or the frontal region. When we talk about the nose, we say it's nasal. When we talk about the eye, we either say it's ocular or orbital. They're both interchangeable terms, ocular or orbital. When we talk about the ear, it's otic. We talk about the cheek, it's buccal, so that when we cover muscles, there is a muscle along the cheek called the buccinator. So when you see the word buccinator, you should go, buccinator. I remember learning the word buccal is cheek, so maybe it's somewhere around the cheekbone. The neck is cervical. Women know this because when they get a pap smear, they're sloughing off the tip of the cervix, which is the neck of the cervix. We've heard of cervical cancer, which is the neck of the uterus that has cancer. When we talk about the mouth, we're talking about oral. And when we refer to the chin, we use the word mental. So when we do bones and we do osteology, there's going to be these two holes here on the chin, and holes are referred to as foramen. So when we see these two holes, they're called the mental foramen. Mental foramen. The chest is called the thoracic region or the thorax. The breast is called the mammary. The abdomen is called abdominal, and the belly button is called umbilical. When we talk about this entire region altogether, that is the trunk. The armpit, right in here, is called the axillary region. So when you get into the cardiovascular system, you're going to learn about the axillary artery and axillary vein. You'll have an idea where it's located. When we do the nervous system, there's an axillary nerve. We'll know where it runs through. When we do the muscles of the arm, many of them have this word brachial in it, like biceps brachii, or brachialis, or brachioradialis. So brachial means arm, which is this portion here, not to be confused with the forearm. Arm and forearm are different. The elbow is antecubital. Antecubital. So on a drag and drop, this has been on a quiz in the past. So here's our frontal region. The eye is the orbit, nose is nasal, chin is mental, cheek is buccal, ear is otic. Okay, now we have these two. And if we had to guess by process of elimination, we're looking at a triangle that's here, and then we're looking at a triangle that's here. So this one is in front, and whenever something's in front, we use the word anterior, and when something is off to the side, we use the word lateral. Lateral is away from midline. So there's a lateral cervical triangle, and then there's an anterior cervical triangle. So hopefully you were able to figure that out even by process of elimination. We are looking at this person from the anterior. What we don't see is on the posterior, on the back side. Okay, now we're looking at the forearm. The forearm is antebrachial. Brachial is the arm, antebrachial is forearm. The wrist is called carpal. You've heard of carpal tunnel syndrome. And in the wrist, there are 8 carpal bones. In 2 rows, there is a proximal row, and then there's a distal row. And each row has 4 carpal bones. So there's 4 in the proximal row and 4 in the distal row. 4 and 4 is 8. So the wrist is carpals. The palm is called palmar. Palmar. The thumb is called pollex, whereas the other digits are called phalanges. Phalanges. The kneecap is called patellar. The leg is called crural. The ankle bones are called tarsals. They kind of sound like carpals, right? So you have carpals in the wrist, and we have tarsals in the ankle. So just remember, you drive a car, the steering wheel with your hand, so carpals are located in the wrist. And then think of the T in tarsals for toes. So the tarsals go with the toes, which are part of the ankle. The great toe is called a hallux, not to be confused with pollex, right? So pollex is the thumb, the pollex is the thumb, and the hallux is the great toe. Just remember the H in hallux with the heel of the foot. So again, hallux goes with the foot, it's just the great toe. And all the other digits are called phalanges, just like the phalanges of a hand. The foot is called a pedal foundation. Just remember, you pedal a bike, pedal and pedal. The thigh is called the femoral region, and the longest bone in the body is this bone here, called the femur. So it's the femoral region. Then we have a pubic region, and then the groin is the inguinal region, and there's a ligament that goes from here to here called the inguinal ligament. Okay. So again, head is the cephalic region, the neck is the cervical region. The upper limb is sometimes called the upper extremity or upper limb. The back is called dorsal, just like the dorsal fin of a dolphin or a whale. The shoulder, the highest part of the shoulder, is called the acromial. And when we do the scapula, which is here, this bone, there's the highest part of that scapula called the acromion process. It creates a little bump for most people on the top of the shoulder there, near the upper trapezius. It's where the clavicle comes and meets the acromion, and they end up calling it the AC joint, the acromioclavicular joint. The back of the elbow that you lean on, if your elbow is leaning on a desk or a table, is called the olecranon. And this specific bump is called the olecranon process. When we do osteology, we'll learn about the olecranon process. The lower back is called the lumbar region. There are 5 lumbar vertebrae. Let's go back here. There are 7 cervical vertebrae. And then from here to here in the thoracic region, there are 12 thoracic vertebrae. So we call the C1 to C7. There's 7 cervical bones, 7 cervical vertebrae. Then there's T1 to T12 in the thoracic region. And then in the lumbar region, we say L1 to L5. Easy way to remember that is you eat at 7 a.m., 12 noon, and 5 p.m. So you have 7 in the neck, 12 bones in the thoracic, 5 in the lumbar. Eat at 7 a.m., 12 noon, and 5 p.m. Cervical, thoracic, lumbar. Cervical, thoracic, lumbar. The rump is called the gluteal region. When we cover the muscles, we'll learn about a gluteus minimus, a gluteus medius, and a gluteus maximus muscle. The back of the knee is called the popliteal. The calf is called sural. The heel is called the calcaneal. The heel bone is actually called the calcaneus, so calcaneal is the heel. And then the sole of the foot is the plantar surface, not to be confused with the palmar surface, which is the anterior side of the palm of the hand. Okay, we're going to look at some of these directional terms. Superior and inferior are opposites. Anterior, posterior opposites. Medial and lateral are opposites. opposite. So let's show you these on a picture. So here is superior and here is inferior. When we are talking about the body as a whole, when we're moving superiorly, we're moving to the top of the body, towards the head. When we're moving inferiorly, we're moving towards the feet. When we're talking about an extremity, like an upper or lower extremity, we don't say superior and inferior. We use the term proximal and distal. We use the word proximal and distal, right? If you're moving further away, you're distant. And if you're at the beginning, you're proximal. This is midline of the body. When you're moving towards the midline, you're moving medially. And when you're moving away from midline, you are moving laterally. So the thumb is the lateral finger. The pinky is more medial because it's closer to midline. The eyes, if we go from midline, the eyes are lateral, and the ears are more lateral to that. If we're moving from the ears and we're moving medially, now we move to the eyes, and then more medial is the nose. Let's go back here. So we did superior, inferior, medial, lateral, anterior, posterior. So anterior means the front of the body and posterior means the back of the body. So in this individual here, we are looking at her from the anterior. Here is anterior, looking at it from the front, also known as ventral. When you go to the back, that's dorsal or posterior. Again, here's the term superior and inferior when we're talking about the body as a whole. In this picture here, we mentioned with the extremities, there was proximal and distal, but the whole body was superior and inferior. Here, when we're talking about centrally located, we can say we're moving cranially or caudally. Caudal means tail. So if we're moving caudally, we're moving to the tail. And if we're moving cranially or cephalically, we're moving towards the head or the cranium. So we did proximal and distal. Let's talk about superficial and deep versus contralateral and ipsilateral, okay? Um, Here we're looking at the epidermis of the skin. That is superficial. If we were to dissect it and look at the dermis or look at the fascia or look at the muscles and the bone, we'd be moving deeper. Okay, so there's superficial and deep. What about ipsilateral and contralateral? So if a patient came in and hurt their right shoulder and their ipsilateral hand, it means their right shoulder and the same hand. If the patient came in and hurt their left arm but broke their contralateral ankle, that means their left arm but the right ankle. Okay, so you want to get comfortable with those terms. When we come back, we'll talk about quadrants of the human body and regions of the body.